My name is Mustafa Isatoin. I am the CEO of MyLikita Health Solutions Limited. It's a startup company located in Nigeria solving problems in healthcare. We have a series of softwares that is targeting different segments of the hospitals and patient management. So we currently have some traction in Nigeria, and we are on the mission to digitize healthcare delivery in Nigeria and Africa at large. So with me on this call, we have two guest speakers, the person of Mr. Laurie Hawkins, who is from Australia. So I'll just give you a brief information about him so that you get to know him better. Laurie has been responsible for getting 8 state governments in Australia together with the federal government and large private and not-for-profit national organizations to agree to a national single source of truth based on a service directory, just like an old Yellow Pages. He's thrilled to share his achievement in establishing Australia Digital Health Foundation since 2012. Since then, healthcare data has been public, both from public and private and not-for-profit sectors. And these have been seamlessly transferred across 8 government borders. All health human services are covered in the National Health Services Library, about 14 million transactions a month. They have about 400,000 health and community services and about 300,000 accredited health professionals. So you can see we have a wonderful speaker here to share a wealth of experience with us. And I believe that all of us will learn a lot from this person. So the second speaker on the call with me is Mr. Titus Njoku. He is an experienced information security manager and digital health specialist with over 11 years of experience in the ICT industry. He's primarily working with Nigeria's National Health Insurance Authority, that's NHIA. His career has been focused on transforming healthcare delivery through digital technology, protecting PIIs, data security, threat intelligence, and digital public infrastructure. His professional journey has been greatly enriched with a background in masters in cybersecurity and digital forensics. He has a postgraduate diploma in computer science and bachelor's in electrical electronics engineering, that's telecom. Professionally, he is certified and trained in IBM Security Intelligence, CISSP, Microsoft SC900, Sophos, API Security, Cisco, etc. While in the field of healthcare technology, he is a certified associate in healthcare information and management system from HIMSS. That's okay. Then he is also a bridge to health informatics program from, I'll tell you a little bit about the HIMSS. It's a bridge to health information program from Morehouse School of Medicine in Georgia, USA, and specialized training in digital health from Central Development Advanced Computing, Mohali, India. He also has some experience with digital health at planning national health systems by WHO and USAID. He's passionate about interested in underserved areas in Nigeria and Africa. So we'll be learning a lot from these two persons during this program today. And I hope that all listen and pay attention, and also get a pen and paper to jot down important points and possible questions that you might be interested to ask about the speech from this class. Brief introduction. Then the purpose of this webinar is to enlighten all of us, to educate us on the advancements happening in the healthcare terrain, especially digital healthcare. So from this program, you will learn how
Hmm.
Major section. We have the opening remark and keynote insights, which will take 30 minutes. It will involve speakers sharing knowledge with us on different topics. Then after that, the next 30 minutes will be a fireside chat and a panel discussion where we'll have the speakers sharing information with us, answering some questions specifically on some specific topics that concerns AI, telemedicine, and digital health at large. Then the last section is where we'll take question and answers. We'll take questions from the attendees, and the speakers will be able to answer these questions. This will be for about 20 minutes, and then we'll have a closing and call to action, which is the last part to round up the program. So a copy of this program of event will be shared across from the charts. So you can check the chart to get access to it. So then we'll be moving to the next part of the program, which is the opening remark from our speakers. So the first speaker, Mr. Laurie Hawkins, would be the one to share his wealth of knowledge on healthcare dashboard and analytics. He will explain to us how technology is reshaping healthcare forecasting and possibilities in Africa and the whole world at large. He's focusing mostly on Australia, but I believe whatever has been applied in Australia is also applicable to us in Africa. So I'll hand over the mic to Mr. Laurie Hawkins to start his presentation. Thank you all.
Thank you, everyone, and welcome to this event. I'm from Australia, so let's just say it's 10 past 11, 11 minutes past 10 in Australia, so it's good night for me, but I'll say good morning to you. So just a little bit of humor there. So my name, as has been mentioned, I'm Laurie, and I'm the CEO of AITIA Global, a company registered in Estonia, but also here in Australia. And tonight I'm going to give you a little bit of a snapshot of what I've been responsible for here in Australia, but it can be utilized in any state or country or a continent. And it provides the foundation for interoperability, such as we have in Australia, where data goes across patient data, which goes across 8 different government borders. So it's only going to be a short space of time. It will be very rushed, but I'm more than happy if you would like to contact anybody from tonight's brainstorm, and they will be able to coordinate, and more than happy to do any further information, questions, etc. So I'm going to share my screen and just give you a glimpse of what we have here in Australia. This is all in the cloud, all in the browser, no software, no data centers required. Obviously, the data can be kept into Nigeria or in Africa, obviously. So I will now share my screen. And this is the interface into the National Health Services Directory, otherwise known as a Health Services Library. And this is the foundation for 14 million transactions every single month, patient data moving and flowing across borders. How it works? Very simple. So you can, what you need, or you can type in the name of a service. So I want to find a GP, and if you have a smartphone and it's geolocatable, it will tell you how to get to wherever you want to go. So as an example, I will put in the postcode 3000, which is in Melbourne, which is the capital city in Victoria, Australia. Just 2 pieces of information. What service and where? Simple. Why can't the rest of the world do it? Do a search, And you will see in a few moments it will come back. And here we go. Because it's closed, i.e., but you can see here, it provides the foundation for other initiatives, booking engines, appointment booking engines, and that will be for the 8th, and it opens at 8:30 in the morning. This will take me off to go and make a booking. Here are the opening hours, public holiday opening hours. This is the public version. It even gives you a map on how to get there. And you can see the speakers, and there are over 80 different languages in this. Arabic, English, Mandarin. And here are the people. The professionals do not have to be shown, but if they wish, they can. Here in Australia, we have what's called a universal health care, but we also pay extra if there is a gap between the universal health care fee and whatever the doctor or whoever is charging. And you can see they do telehealth, and there are numerous languages. Everyone can see that. Next, very quickly, here you can see all the different types of services. We're talking about health and community care, but the very first thing you should note if you're going to embark on digital healthcare is you start small, win quick, deliver benefits quickly. That is how I have achieved what you're seeing in front of you. And this has been going for 12 years. And this has public, private, and not-for-profit all in one directory used by thousands and thousands of organizations instead of silos of what we call provider directories. You can have one national, and because it's national, it also contains what we call HIPPOs and HIPPIs, and these are individual healthcare practitioner identification and organization, and they're unique. And all that happens from a GP software or any other software. It automatically comes and finds them, encrypts the software with a PKI certificate, and shoots it off. All happens 14 million times a month. And as you can see, we go from A to Z, etc., etc. This is going to be very quick. Here is the federal government using a portion for pregnancy, birth, and baby hotline for parenting. And you can see that it's all different types of services, but it's customizable to what you want there. There, we just make a move of this thing down to the bottom. Next, we have West Australia, and everybody can customize. Each different state and territory has their own different view, but it all uses the same API, same directory. So if you want to see where all the emergency departments are, and this is in Perth, WA, and you can see it's open now, and you can see all the other ones. However, if you want to see where all the GPs are, and you can see all this with a dot we can look at and open up, click on any one of these. This is the public view, opening hours, what they do, show more, child health, drivers medicals, cool, that's a new one, workers compensation, bulk billing, mixed billing, etc., etc. I'm going very quick. This is the smartphone app that anybody anywhere in the world can use to find GPs, doctors, everything that's in the service directory you can find on here. So, for example, in Nigeria, across all of your different states or across different borders in countries, doesn't care. This is how you introduce standards by having the same infrastructure. Instead of going off doing willy-nilly, this one is how to find the health services. Don't take my word for it. This one over here is a media article about two countries, Macedonia, Northern Macedonia, and Serbia, who have taken the concept of this system, and I'll just highlight a number of items within this article. And this was in 2013, they implemented it in Northern Macedonia, and they eliminated waiting lists within 6 months because they joined up all of their healthcare. Then you can see over here, GP specialists continue to use their own software, but they're fully integrated. There are more than 100 third-party software applications. Don't give me any, we can't do this. Yes, you can. You just need the willing and the vision and a little bit of money. This does not cost millions or hundreds of millions. Now, if you'll note
cut you off, Mr. Laurie.
Yep.
Hello.
Hello.
Yes, we lost you a bit. Yes, your network went off a bit. We didn't get what you said in the last 30 seconds.
Okay, thank you. I'll just start on this one again. The concept of what I'm showing you here, which is in Australia, has been adopted in two countries in the Balkans, Northern Macedonia and in Serbia. And I'll just highlight a number of items. The company rolled out, this was in 2013, they rolled out a national health system for less than $3 million. Now, Titus is moving, so that's good. And they eliminated waiting lists in 6 months. And you'll notice that this also accommodates third-party software. So this enables different EMRs, whatever, to all integrate into a national system based on information. And we get to, I will point out just for yourselves that this country has moved from 27th in the European Union to 16th. And there has not been any increase in beds or machinery. No extra MRIs, no extra X-rays, nothing. And then Serbia, which I mentioned to yourselves, they did the same system and they did it for under $5 million Australian. That was 10 years ago. So obviously costs have gone up. And here what you have is a public dashboard for Northern Macedonia. This can be available. This is the public view of their system. Wouldn't it be great if government departments shared one system and utilized it for better health, more effective healthcare? The options are here. You just need to look at it instead of reinventing the wheel. And this is not expensive.
Mr. Laurie.
Yep.
Okay, please go on.
Okay. So what I'm just saying is, as you can see, today we've done 110,000 appointments. 12,000 prescriptions have gone over the pharmacy counters, and I'll leave it there and just get rid of it. Once you have all this data, you can actually start to use visual data analytics, data warehouses, and potentially AI. So what we have in here is another initiative which I've been responsible for, which covers all of Australia. So what we're going to do is just show you from the census data, and this is where you can incorporate census data, health insurance data, you can incorporate anything. And I'm only showing you a small portion. But this is what I'm just going to show you, the traditional way of showing data, which is heat maps. However, we use bar charts. And as you can see, we'll just go back to the chloroform map. You can't see little dots of red because heat maps mask data. Change it to geo bars, and there you can see your problem areas. Next one we go is boundaries. We accommodate boundaries very simply: aged care, community. Look how fast this is. Everything is in the cloud. Just need a browser. Local health networks, heat maps, traditional color. Everyone can do that. But geo bars, as we'll show you here, we're going to show you the First Nations people again, and just with the bar charts. Very quickly, it just demonstrates one piece of functionality. Here, you can see where every single, here is where you can see every single physical GP, pharmacy, podiatrist, emergency department. The list goes on and on and on. You can also see how we group data. So I can just go and clear the map. And here are all the categories for allied health, cancer services. And if you want to see where all the chemotherapy is done across Australia, not many at this time of night. And let's have a look at skin cancer. Let's go down one more. Child and family, parenting support, etc., etc. Here we have an example of immunization. Children fully immunized at 1 year old. You'll notice we can have the traditional way of showing data. This also shows you the trend charts, which we do. And I'll show you a bit more later on. And this is where all the GPs are. This is in Perth, West Australia. But let's go back and just put that in. And the blue is the administrative border for local government. However, if we change it to primary health networks, you can see the data changes according to the different administrative boundaries. Why wouldn't you want to use that? Next, this is very short. This is our global platform. Well, this platform covers the globe. We can go down to a postcode, but this covers COVID. And we have all the data from the World Health Organization from the 3rd of January 2020 till the 18th when they stopped publishing it. But the reason I've come for the 23rd of November 2021 is people have short memories. Now, what we're showing you is a traffic light system, and we have successfully indicated every single wave of how COVID was spreading. Now, I'm just about to show you in a minute, and you can look how fast it is. And we can also change it to bar charts, but with the values turned on, which we'll turn off in a minute. But I just want to go back, and South Africa announced Omicron on the next day, and you'll notice they suddenly went to 9.9. So very red, you're in deep. I'll go back one step. We use a 5-week rolling average, not 7 days or 14 days that everybody else on the planet used. So we take a week 5 weeks ago and compare it against the last 4 weeks. And you can see down in here, you can run it across to show you every single day. This could be in a postcode. This could be a state. It could be, doesn't matter. And we can select Africa. There you go. And I'm just going to run forward now. And you can see how Omicron in a few days overwhelmed many countries across Southern Africa. and then it started to spread across the world. And using our traffic light system, not only that, let's go back to the bar chart, and you can click on the data and you can load it up and you can download it to your business intelligence tools. Smart thinking. Over here, you have our data catalog. Not responding. Not good. We may have to start again. Always happens when you're doing a presentation. Okay. Here we have Africa. Sorry, USA. And this is by state. 24th of November, the day after Omicron. Look over here, you can see there is only one state, Missouri. However, the purpose I'm showing you here, and we'll change in a minute, is you can do a video. You can do so much with so little, for so little cost. Now, I'm going to advance to Christmas Eve. Omicron has been announced, and you can see over here, they're starting to be invaded by Omicron, or an increase. And it starts to get worse in the new year. Now,
okay,
next
Mr.
one
Laurie.
I'm going to show you, which I think, yep, am I over time?
Yes, so you can just try to round up so that we can manage the
certainly.
time.
Thank you very much for your intervention. What I will do is just show you this one, which is, I suggest, of a value in many different countries and continents. This shows you how you can use data analytics, proximity of influence, derived data, or unrated estimates of the underlying data falling within the regions. These help organization services potentially to influence local community health outcomes in areas of need. And I'm just going to turn it off. And here you can see from census data, how many people are in this particular area, how many people are indigenous, how many people have need for assistance, etc., etc. And the very last one is, we call this in private data. And this enables anybody to utilize a common set of data sets, but use personal identifiable information, cancer patients, doesn't matter who, but the data does not leave your PC. It's only in the browser. And just to show you, you drop a file in, and this is all the toilets across Australia, public and private. And I will go and turn it on in a moment, hopefully. One would like to think it will go. Oh, well, we'll try again. Never goes well. And I think you'll find that this will then work. So what we're saying is you can mix and match data, and there are all the public toilets across Australia. And you can mix and match. So thank you for the short presentation. I'll now hand over to Mustafa and Titus. Thank you.
I'll pass it over to Mr. Titus to give us a presentation. His own presentation on digital health and advancement in digital health. Thank you very much.
All right. Thank you so much, Mustafa. Thank you so much also, Laurie, for a wonderful presentation.
Since you are muted, we can't hear you. Oh, okay.
Can you hear me? I'm sure. Okay. So thank you so much for the opportunity. Let me share my presentation. Please confirm you can see it.
Yes, we can.
Yes, I'm sure.
Okay, thank you so much.
Yes, we can.
Okay, all right. Like the moderator rightly identified me, my name is Titus Njoku. I work with the National Health Insurance Authority here in Nigeria, and I'm here to make a presentation on digital transformation in our healthcare system. First, we would like to, if you look around the world, digital transformation has really ushered in a new era in our health care environment, replacing the traditional old practices with new cutting-edge solutions. Like in the past, healthcare landscape were all marred with manual record keeping, limited access in vital medical informations, and sluggish communications between healthcare providers when we lack interoperability among stakeholders. These challenges has also contributed to inefficient patient record management and has also restricted access to medical insights and delay in service delivery. With the advent of digital health transformation, it has also proven to be much needed remedy for the long-standing issues. So in this presentation, we're going to explore the various ways this digital transformation has revolutionized our healthcare sector. Now, why technology? Technology is very vital in healthcare because it enhances patient care. It has also improved efficiency, reduced costs, and expand access to services, ultimately leading to better healthcare outcomes and more proactive approach towards our wellness. And what are we looking at that has helped in the use of technology? Technology has also helped us in bridging gaps. With this technology, like form of, for example, the bridging of gap, technology has also helped us, get access or even most of our remote areas. These are the places that we had limitations, but now with the use of technology, we can be able to cover those geographic areas. And also sometimes we have limitations in our resources. Technology has also helped in bridging those gaps. Technology has also helped in both in better patient care, patient experience, satisfaction, and when people or our patients are well informed, they get all this information through the use of technology, and that has also helped most times in reducing of medical errors. That has really been a major issue or challenges in the past,
Okay.
So
sorry, Mr. Titus, can I quickly cut you? So can you share your screen? Can you make it to be in presentation mode so that it can be larger, because it looks smaller? Yes, absolutely.
It's better now?
Thank you. Yeah, it's better now. Thank you.
Okay, so what are the key technologies in healthcare delivery? Currently now, technology like telemedicine, mHealth, which is mobile health, AI and big data, electronic medical health records have all been very instrumental in the technology revolution in the industry today. If you look at the use of telemedicine, remote areas can now be able to deliver healthcare services, using telemedicine. Most times we also use mobile phones and through different applications, to access medical services, healthcare services, even monitor our health, and also health education. These are things that technology today has helped us to be able to give us first-hand information on critical issues that concerns us and our well-being. Also, if you look at AI and big data, currently now in the world, we all know what artificial intelligence is currently helping in, it's been a very vital tool in our technology today that has helped us significantly, especially in the healthcare environment. Now, if you look at, therefore yesterday, Microsoft launched one of their AI clinical decision support system, which is the Microsoft Dragon's Copilot. These are very mind-blowing technologies today that are really helping in the health ecosystem and health space today. And they also look at the Glass Health AI clinical decision support. These are also like EHRs that are also helping the medical doctors form their decision when administering care to patients. Today, okay, we also look at the digital. How is the digital health transforming? Digital health transformation happening in the global space. Let me play this this video in this slide here. This is when I was in India, in one of the remote healthcare facilities in Chandigarh. What makes here more revolutionary is that these people have utilized a solution called the eSanjeevani, a telemedicine platform that anchors over more than 320,000 consultations every single day. Patients, people from the village access care through this platform, through this telemedicine platform, at no cost. All they do is just walk into any facility. They have interface with the operator at any facility there, and they will have first-class medical consultation with any medical doctor in India. Every single day, you have over 320,000 consultations happening in India. And this platform has also served over more than 166 million patients remotely. If you also look at in Zanzibar, which is current Tanzania, where you have 1.6 million national digital, 1.6 million people who are currently on their national digital health system, who are also connected remotely 100% to their healthcare workers. Then we also look at in Rwanda, we have over 2.9 million Rwandans, who are also leveraging on digital health in assessing care. Being that Rwanda has over more than 90% of Rwandans have health insurance, but lack access to care. So when Rwanda also noticed this gap, what they did was to leverage on digital health transformation to bridge that gap. And to bridge that gap, they have over 2.9 million citizens now currently registered on their platform, on their digital platform, to access care services, across Rwanda. Now, I know that a lot of people here will be asking, where is Nigeria in all this? But I can give you the good news that in 2024, the Director of Planning and Director of Planning of Health Planning, Research and Statistics in Federal Ministry of Health, Dr. Camille Sorite, disclosed that the federal government earmarked 14 billion naira in the budget to promote digital health transformation and innovation in Nigeria. Now, that also led to in March 2024, the previous Minister of State, Dr. Tunji, inaugurated an agency called the Nigeria Digital in Health Initiative on March 2024. Their aim was to enhance accessibility, efficiency, and also help in healthcare services. Not only that, if you look at the NIDA, that is the National Information Technology Development Agency, on 5th July 2024, they also came up with collaborating with some of the healthcare services or healthcare organizations to promote this digital transformation. They collaborated or partnered with the Health Center of Excellence for Population and Health. They help them in healthcare delivery through the use of technology and innovation. And also looking at the NIDA, looking at the NICOM Health, the organization being the organization that championed this revolution is the Nigeria Communication Satellite Limited, NICOMSAT. They also launched out a solution called the NICOM Health, being that they are leveraging on satellite to be able to provide telemedicine across Nigeria. And these are services that are really today been changing the entire landscape. Then if you look at the National Health Insurance Authority, they also identify that most Nigerians, not just only about having access to care. The current Director General, Dr. Kelechi Ohiri, in his own wisdom as well, came up with the digital transformation agenda for the organization, where they are now leveraging on technology to be able to bridge those gaps, to be able to bring access and care to Nigerians, being that also looking at the number Nigeria has, about 200 million. Most of the challenges that Nigerians are facing is access to healthcare. And the National Health Insurance Authority today are bringing in solutions, technologies that will bridge this gap. And I believe that in a few months from now, Nigerians is also going to see this transformation, this digital transformation that the current administration is bringing up on board. I want to mention them, but I believe in few days or weeks from now, Nigerians will start also experiencing it firsthand. Then here brings us to an idea of what the digital health transformation that is happening in the health insurance, system or industry. Sorry, let me play this.
Sorry, Mr. Titus, we can't hear the audio. It's not audible. I don't know.
Hello? Okay,
Yes,
you can't hear the audio.
audible.
We
Okay, it's
can't
not
hear the
audible.
audio, yes. It's
Okay,
not
hold
audible
on.
at all, yeah.
Okay, just a minute. Let me get it out. Please confirm you can hear me, hear the sound.
We can't hear you.
We
We
can't
can't
hear.
hear the sound.
You can't hear it? Okay. All right, no problem. Let me just move to the next slide. All right, okay, so we're going to talk about, let's look at the case study here in Nigeria post-COVID. Healthcare, in the context of healthcare, where Nigeria, we have already over 200 million Nigerians that need access, healthcare access, So what are the technologies, what are the solutions that we are leveraging on to help bridge these gaps across the states or the country itself? Now, first, we'll talk about the electronic medical record, which is a digital version of patient medical record containing information like demographics, medical history, test results, and medications, facilitating efficient healthcare coordination and improved patient care, because this tool has also helped the medical doctors in capturing informations as they are administering healthcare. For me, I always say that this is the very first step towards, better healthcare service, being that most of these vitals that are being captured are now being captured electronically, and not just only capturing electronically. These data can easily be moved from different healthcare facilities, being that you can share your medical records across every facilities. It has really helped in managing people's care, managing people's healthcare records in various facilities. Then if you also look at the telemedicine, this is also the use of technology to deliver clinical care at a distance. This has been very transformational for the country. A lot of startups, organizations are leveraging on this platform to be able to get medical services, either through just this radiography, telesurgeries, and telepathologies. These are solutions that are leveraging on telehealth, that are being used after post-COVID, and they are really helping in bridging gap and also closing making people to access care at every corner around the country. Many people also have been leveraging on mobile health applications, to manage their well-being. These are applications that has helped in making people well informed of what they need to do, at any time. For example, I myself, I use my mobile phones here now paired with my wearable devices. This has also helped me to curtail my calories, watch my steps, what I need to do. I monitor some of these things now by myself because I am well informed using my mobile apps. Then another area that technology that is also helping in the country is the use of the Health Information Management System, the HIMS. Nigeria saw that is very critical. That was why they adopted the DHIS 2 in terms of data collection and reporting across primary healthcare centers, across the different national facilities and teaching hospitals, being that information is key, information is power. Most of the things like what the first speaker highlighted, this collection of those data could happen through the use of the DHIS 2, and what are the outcomes that we get through this use of technologies? It helps improving accessibility and also coordination in healthcare service. It also help enhance seamless communication and information sharing among healthcare providers. It has also helped increase efficiency in patient management and data collection, and being that it also helped public health response during the pandemic. For example, like we had in COVID-19, the Mpox outbreak, the Ebola, also the Lassa fevers. These are technologies that has also helped us in managing this issue. Then if you also look at the AIs and the big data. Hello? Yeah?
Yes. Try and round up. We are the time allocated.
Okay.
Yes.
All right. So we look at the AI and the big data. We already, like I mentioned it earlier on before, AI and big data are being very, very instrumental in today's medical service delivery. Today, also, we have the wearables, that's our smartwatches, the IoT devices, which are game changers in preventive care and chronic management. Then we talked about predictive analytic tools. For example, like also what Mr. Laurie presented, our regulatory and health organizations could now leverage on data to be able to predict outbreaks, across the country. And these technologies has also helped us in analyzing, medical data. Now, there are some future challenges and barriers that hinder development. For example, we talked about the cultural and societal factors. We talked about the infrastructure deficits and connectivities across the country. We looked at also the regulatory and ethical issues that happens to do with poor standards or data privacy across an inadequate legal framework. Then we also looked at the digital literacy, being that we have shortage of IT professionals and also low digital literacy among patients and healthcare workers themselves. They lack information on what to do, Then what are the approaches towards bridging this digital divide? We encourage we prioritize targeted interventions that will bridge both urban. Oh my God. Oh my God, oh my God, oh my God.
What happened? Where with you, sir? We can hear you.
We can hear you, Titus. I suggest that you round it up as you've had your time. Thank you. I think we may have lost him.
Okay. Okay, while he's trying to join, I would like to say thank you to everybody for hanging on, and I hope you are having a wonderful session. We're all learning from this session. Okay, he's back. I mean,
hello, can you hear me? Sorry about that. Network.
We can hear you now.
Okay, sorry. Let me go back to where I stopped. Okay, so let me round up. We almost we were talking about the approaches towards bridging this digital divide. We also looked at fostering how we need to foster innovation and local solutions by leveraging on Likita, also leveraging on AITIA in terms of predictive analytics. We also looked at how they can enhance digital literacy for healthcare workers, expand broadband and infrastructure with poor networking facility across the country now. These are also part of the hindrances that has affecting the digital transformation in the health. We also looked at develop a digital strategy roadmap. It has to be a national digital strategy roadmap that will guide the country on every phase of achievement or accomplishment towards realizing this divide. We also looked at we need to promote our culture and adaptation and community engagement by reaching out to these health workers, our traditional leaders, telling them the reasons why this digital transformation is very key in helping helping the people access better healthcare services. We also talked about improved data governance and interoperability in terms of our standards. There has to be a national standard that will help us in terms of exchanging information, for everyone. We ensure by also ensuring sustainability financing. Financing is also very, very key if we must achieve digital transformation in Nigeria. These are the approaches that I believe that could help in bridging this divide. Okay, I will say by Dr. Tinju Al-Hassan that said that the future of Nigeria healthcare lies in our ability to innovate and collaborate. By unlocking the health value chain through digital transformation, we can create a system that not only serve our present need, but also prepare us for future challenges. I believe the present is digital, so is our future. Thank you so much.
Wow. Thank you very much, Mr. Titus. I think this session has been very educative and enlightening. A lot of things going on that some of us might not even be aware of. Actually, when you were talking about other countries and in terms of digital health, I was a bit feeling intimidated. But when you go to the slide where you're talking about, I think the government and even the private, they are really taking huge steps in order to achieve digital transformation in our healthcare sector. And I believe that's a laudable effort. And I pray that everybody, I pray that this dream is achieved. And I want to encourage everybody to always feel as part of this program, because you don't have to wait for the government to do it. At your own level, there are smaller steps that you can also take, like the one you cited example of how you're monitoring your own healthcare, like progress of your health by using digital watch and some other digital devices that are very portable, mobile friendly, and you can always be able to track your own health record at your fingertips. So thank you very much for this session. I would like to take a brief moment to introduce MyLikita again, because the first session where I did a brief introduction, I believe some of the participants have not joined, and I would like to do another introduction. So basically, MyLikita is a healthcare company. Is a technology healthcare company, or let me say health tech company. It is a subsidiary of Brainstorm IT Solution, which is a custom solution provider located in Nigeria. We have Brainstorm has been in the industry for about 2 decades, and they have been building different solutions across different industries, both with government and non-governmental organizations. So MyLikita is a subsidiary company focusing mainly on healthcare. So we basically try to digitize healthcare records of patients, while we provide healthcare facilities with other solutions such as patient billing, patient information management, pharmacy management, lab information management, including radiology and teleradiology. So we also have our product for telemedicine currently on the pipeline. We are hoping that very soon it will be launched. So this solution actually came up as a result of healthcare accessibility that we have as a challenge in this part of the world. And we believe that the poor, let me say the low income part of the population also needs to be considered when implementing the solution, because they are the one that constitute the larger part of the population. So the solution we are bringing on board is a bit different from the existing telemedicine platforms that we have in the country. It is more focused on the rural area, just like a case study that Mr. Titus presented while making his presentation about how India transformed their healthcare services delivery. So we are also trying to come up with something like that. Hopefully, we can get support from government and non-governmental organizations to make this achievable. So thank you once again for the presentation. I would like, okay, on this note, I would like to implore all of us, for those that have questions, please kindly go to the chat section and drop your questions, so that when we get to the question and answer section of the program, we can take the question. We'll take it in the order of arrangement. So please drop your question as soon as possible, so that because we have limited time to handle the questions. So the next segment we're going to move to now is the fireside chats segment, where we will have some specific questions about the presentation that has been made so far. And we would like the speakers to enlighten us more on those areas. So let me quickly share my screen so that we can start that. Okay. First side, chart, for those that don't understand what is this session mean, as I explained earlier, it is basically going to be a question and answer where we have some specific questions for the speakers and on this. So the first question goes to the both speakers. I'd like you to share your experience based on this. So we understand that AI and telemedicine are transforming healthcare globally. So in what ways do you think, have you seen these technologies directly impacting patient care in Nigeria and healthcare and Africa at large? So please, can you share your view based on this? So I would call on Mr. Laurie to go first, then you can have the second speaker.
Okay, well, I'm probably a bit controversial, but anyway, I'm what's called well, my views on AI are interesting, and they definitely have a place in healthcare and transforming already. However, there are limitations, and although they are the end game, the optimal of every single person having personalized healthcare, let's go back to basics. So health inequality is for everyone, not just for one section of our society, whichever country. And I'll come to that in a minute. Here in Australia, like many other countries, telemedicine has taken off since COVID and just exploded, and it certainly has a place in the world. And for many countries, especially developing countries, it is a shorter route to getting universal health care compared to traditional countries or developed countries which have legacy systems, legacy infrastructure, etc., etc. Hardly, apart from Estonia, which is 1.5 million people who have a connected healthcare system, and also to mention Northern Macedonia and Serbia, no other country has joined up health records, etc., etc. Do the basics first. I'll keep preaching. Everyone has a grand plan. You have a master strategy. It's a bloody waste of time. Excuse my French. A, money. G, politics. C, the ground changes. The environment changes. Do small incremental steps, not massive, great big plans. Oh, it looks good to the public and politicians like it. Sorry if there's any politicians on the line, but so telemedicine, not a problem. Fantastic way to get AI is for the future. Healthcare here in Australia and many other countries is what we call risk averse. It has been shown that AI can swap. And there was an example given of somebody with breast cancer. They gave the wrong side, left instead of right. How would you feel if you were told that AI made a mistake? No, humans still need to intervene. Other items which people forget. AI is not artificial intelligence. That's what it stands for. But that is not what it is. That is still some way away. It is large language models. And the only reason that this has come about is because of the processing power of computer chips. And NVIDIA, I think a US company, has made a tremendous amount of money because they provide the chips. And I may get this wrong, but I think there were 1 billion transistors on a chip, which is unheard of. Processing power has gone exponential. However, we need data centers, and data centers consume electricity. Now, a case in point is Ireland. Over 30%, I think it's about 40% of electricity produced in Ireland is consumed by data centers. Every time you type into Google, ask it the question, you use enough power to boil a kettle of water. So obviously it's got its place, and the amount of money being plastered into data centers everywhere across the planet is incredible, but they need power. And as we have seen here today, and even Australia is not immune, we still get power cuts. We don't have enough capacity. Everyone is going to what we would call renewables. However, you need baseload power. So look, I could go on and on, but definitely what you see, it has a place, and in many areas such as transcription, etc., fantastic. And there are many other initiatives, but get the basics first, and they're a lot cheaper. I'll leave it at that. Sorry, Mustafa, I'm carrying on like a pork chop, as we say in England. Thank you.
Yeah, thank you very much for sharing your view. I believe your view is also very practical, and it has opened our eyes to how these technologies are being impactful to our own region from your own end. So let me allow Mr. Titus also share his view. Please, let's make the answers brief so that we can be able to accommodate other questions.
Okay, thank you so much. In my own opinion, AI has come to stay, and they are not here to replace anybody, but rather it should be a platform you leverage on to make your work more efficient. AI has like, for example, with the electronic medical records, the integration of AI into the electronic medical records for the clinical decision support has helped the medical doctors in narrowing down, diagnosis, helping them to make more proper decision, of whatever patient outcome and give the best to their patient as well. So AI is rather a tool that helps to complement what they have, or what they presume could be an issue, is very key for decision making. Then if you look at telemedicine, also like Laurie mentioned, telemedicine has also helped. It's not just meant for maybe for the urban people or people living in urban, specifically it should also cover people who are living in these rural areas, whereby we have shortage of medical doctors or personnel in the country. But these technologies will help, even when you have doctors who probably could be a Nigerian who is living in Australia, can still be seated in Australia and administer consultation to someone who is living in the rural area. That's the power of telemedicine. It helps to reduce those gaps that are being felt across all in any community or country. For example, here in the health insurance ecosystem, we have people, the health maintenance organizations. They have already seen that telemedicine is very key for them to provide help the enrollees access care. And that is why in their mobile apps, you see them now bringing in this model into their components, telemedicine as a service, so that they can be able to, it's not all medications or services that you require someone to go to the hospital for. There are basic services that can just be handled over through telemedicine platform. And that is why we believe that they are also very key in transforming the healthcare globally. Thank you.
Yeah, thank you very much for this insightful contribution. It's very interesting. I believe from my own point of view also, I think recently or some time ago in Africa, there was this statistics, or let me say Nigeria specifically. There was this statistics about the ratio of doctor to patients in the country. where we have one doctor attending to over 1,000 patients. That's because we don't have a lot of these skilled doctors located in the country. I think this is what gave birth to telemedicine, which has been improving the situation since after COVID. But another option that also helped us achieve a tremendous improvement in this aspect is AI. I'll use our platform, MyLikita EHR, for as a case study. Here in the northern part of Nigeria, we have hospitals, big hospitals, with a lot of patients. You see a hospital or a doctor, a consultation room, having a queue of over 100 patients waiting for that doctor to attend to them. And all of them needed to be attended to on that same day. So this always brings in a lot of discomfort for the doctors. They end up being pressured to overlook some basic signs that they can notice from the patient because they have a lot of workload on them. So in this aspect, AI has really helped a lot. We recently implemented a feature for a hospital here. It is an AI system which we deployed for that hospital that immediately the doctor started attending to a particular patient, provided that the previous medical is available, whether in digital copy or in a scanned copy into the system. So the doctor is able to get a summary of the past consultation, the past lab tests, all these medications that have been prescribed to the patient in the past. The doctor can now get a more informed information based on the history of the patient without having to go through all the files all over again, because most of these doctors, they see patients everywhere and they see patients a lot. So it isn't easy for them to keep track of all this information in their head. But with the help of this small AI integration that we just quickly added for that hospital, they have been able to achieve tremendous improvement, especially in terms of how the doctors are able to provide quality healthcare services to their patients. And also it helped them to reduce the time it takes for the doctor to attend to a patient, while also improving the quality of the healthcare service that the patient enjoyed. So thank you very much for the insightful contribution. So our next question is on healthcare dashboards. So from what we have seen in your presentation, Mr. Laurie, healthcare dashboards and analytics are transforming decision-making in the industry. Based on your experience, what kind of metrics should African healthcare systems prioritize to improve patient outcome and operational efficiency? So for instance, we have a deployment we're currently running in Kano State, where we have to design a system that is deployed, that we have to deploy our system across about 40-something hospitals, like 40+ hospitals in the state. So, and all of these hospitals needs to have communication with a particular dashboard, a healthcare dashboard that will be available to decision makers in the state. So this question, we are trying to learn more about what kind of information should be prioritized, especially when looking at this dashboard, and how it can improve patient outcome and operational efficiency. Thank you very much. Please, Mr. Laurie, over to you.
Thank you. Interesting. And I keep coming back to the basics. Unless you have connectivity, interoperability, standards, which we have from adopting one single national source of truth, but it can be a state, so that public, private, and not-for-profit can all work in harmony. Now, many countries, in developing countries, and from what and even I get it as well, internet connections are not the best. So you need to have, and if the government doesn't provide it, then you need to look outside the box. And I would suggest that satellite, as Titus, I think, has pointed out, is an option. And by connecting up the 40 hospitals or for whatever you're doing, you then have the chance to create dashboards that will allow more effective use of existing resources. Why? And I've just pointed out 2 countries that did not add one single extra bed or anything, but they eliminated waiting lists, i.e., that is how effective use of resources is and saving money or making your money go further. So there are lots of, as I say, pharmacy, drugs going over the counter. There are a whole raft of different initiatives, and Titus really pointed out some good ones, i.e. literacy amongst your people who use the system, many others as well. But you need to connect everything up so that you can then start to make more effective use. In Serbia, they used to have a boundary, i.e. within a state, and that's where you went. However, the government of the day said, we don't care about that. And patients, if they're nearer across a border, somebody draw lines in the map and says, you can't go there. However, the patient, i.e. the consumer of your services, they actually want to go a shorter distance. And if they can be seen a lot earlier, 6-8 weeks, I'm just pulling figures, that is how they eliminated up to 18 months of waiting to see a specialist, and how much pain, suffering that person, plus their family and everything else. So make use of the basics. Sorry if I'm a rebel and people think about money. Well, let's think about people. Patient-centric. I hear so much about it. Very little is actually proven, to me anyway. So I'm a bit controversial, but I've been responsible here in Australia, and that dashboard I showed you how many requests, how many referrals. You imagine getting down that to de-identified data and how much you can make use of that data, and then putting that data into feeding it into large language models, and what you can get out of it. It's amazing. Start with the basics. Sorry, Mustafa, I'm a bit controversial, but that's just my way of thinking. I think about people. Thank you.
Yeah, thank you very much. I think you've answered the questions. Yes, we understand the need to start with the basics. And so far, I think the basics as presented by Mr. Titus, here now the basics have been established to some extent. So which is what is giving birth to the next iteration, which is how can you now make use of, yes, EMR has been adopted across several hospitals in the country, which for now, there's not yet a way of implementing interoperability standard to connect these systems. But in a situation where a particular government decides to focus on their own region to implement this standard and ensure that the shared database, the shared dashboard is provided. So I believe the point you have raised about requests, referrals, and other ways to make use of the data, I believe that point is very is very useful to achieve that result. Thank you very much. So then the next question is for Mr. Titus. We understand that one of the major ways or one of the major advantage of telemedicine is accessibility. So how do we bridge the digital divide to ensure that rural and underserved populations can benefit from these innovations? So over to you, Mr. Titus.
Okay, thank you so much for that question. If I may borrow my experience in India, India with over 1.2 billion citizens, in terms of their population, identify that there is need for them to also incorporate people who are living in the rural areas, which also has a rating of over more than almost 60% are living in the rural areas in India. So what did they do? They came up with a national health mission agenda, whereby they invited all their telcos, all their telecommunication industries, and mandated them to provide fiber links as part of their corporate social responsibility to all rural centers, all healthcare facilities, primary healthcare centers. What they now did was they all ran fiber links to these places so that the national telemedicine platform can now leverage on those platforms or on those connectivities and provide services. So I believe here in Nigeria, our government could also do the same, whereby we invite likes of MTN, Glo, Airtels, Men1, they will come and provide connections, fiber links, draw fibers to all these rural areas. Even with organizations like NICOMSAT, provide satellites to all these government private healthcare centers to have connectivities or have connections, so that when you are now adopting telemedicine, you will see that things like all this public health infrastructure are already on ground that can be a soft landing for telemedicine to run on. So it is very key that the government adopt such kind of strategy in building public health infrastructure through this partnership or collaborations with this healthcare provider, with these telecommunication providers to provide services like this. They're all making good monies from Nigerians, but I don't think it's too much to ask if they could also provide these corporate social healthcare responsibilities by giving us connectivities or internet services in our rural areas that will help us bridge these gaps. Thank you.
Thank you very much. Those are very valid points. And I believe with your organization and all these other organizations like NIDA, the the Agency for Communication, that's NCC, and all these other ministries, I believe they are going to be able to look at these areas. And from our own end, we also implement what is achievable from our end to ensure that this healthcare accessibility is equally shared across. So thank you. So then the last question for Mr. Laurie. Australia has made significant strides in leveraging technology for healthcare forecasting. So what lessons can Africa learn from Australia's approach, and how can we adapt these strategies to fit the unique challenges of our healthcare landscape? Over to you, Mr. Laurie.
Thank you. Well, it goes to the same for me. One, you need a national single health services library, because it gives you, as the example here in Australia, there are over 300,000 accredited healthcare providers. And yes, there's regulations and everything else around that, but that then enables the leverage of using individual health identifiers, or what we call HIPPIs, and organizations are HIPPOs. And by doing that, you can then leverage, as I've shown you in Northern Macedonia, you can see in real time what is the operations, how many, and start to then utilize that data with other data sets, such as census data and education, warehouses, the social determinants of health. As one example, Africa is relatively lucky, but most of the developed countries around the world have an aging population. That means, and Blind Freddy could have told you 10 years ago, and we're no, i.e. there's going to be less money less people who will pay taxes. There will be older people who want healthcare. Increasingly, I can't give you the figures, but the older you get, the more healthcare, more complex it gets, the more expensive it gets. So by utilizing the data and doing data analytics or forecasting, and the same when you put in blocks of houses, infrastructure, you need the infrastructure, the roads, the schools, etc., etc. All of those can be adopted across Africa. I demonstrated our platform, which can be just for Africa, it can be for the whole world, it can be just for one state, because we can go down to a postcode, etc., etc. Data is the key. Healthcare is a mass with silos, thousands, tens of hundreds of thousands of silos of data. Well, that's not much value. It's of no value. Every other industry, including the telcos, etc., etc., all make use of data. So quickly, cheaply, and just start with the basics. And it only needs one country to start. Crikey, it doesn't need everyone. But what wasn't in my introduction was, here I live in the state of Victoria. I was given the task of making the National Health Services Library on a state basis a success. Then another state or another government heard about it. They then flew me up to their capital city, Canberra, and then the Northern Territory adopted it. 3 governments out of 8. Suddenly that got federal government attention. And then that was how we managed to, well, I persuaded everyone that we needed. And because you have the same data elements, you have the same governance, etc., etc., you have the building blocks for interoperability, for pushing data across, data analytics, even pandemics. I've yet to see the WHO or anybody, after I think 2 years of talking, we still do not have a pandemic alert system in real time. So, as I say, I've demonstrated to you that can be changed, and we can track all the diseases, all from one platform. Anyway, enough of my babbling on. I get very, the tools are here. It just needs leaders. And I say leaders, not managers. People have lots of labels, but management is mostly on them because they don't want to lead. Thank you for your time, and hopefully that was a good answer. Thank you.
Yeah, absolutely. We understand from your point of view, and I think the answers you provided are quite befitting. If all these basics, like the basic infrastructure, the basic system, basic data, all of this, if they are all provided, I believe it will give room for a robust dashboard where the data can be understood. So thank you very much for that.
Thank you.
And then lastly, for Mr. Titus, we have a question for you. Data privacy is a major concern in digital healthcare. Yes. And what regulatory frameworks do we need to have in place to ensure ethical AI use and secure telemedicine services? Please share your idea on this. Over to you, Mr. Titus.
Okay, thank you so much. Data privacy, at least I'm happy that the government of Nigeria, through the Data Protection Council or Data Protection Commission, has enacted a law for data privacy. And that also cut across both for healthcare, data, whatever kind of data that is emanating out from this country, For example, for the health environment, for the healthcare sector, you have the HIPAA, for every hospital, or, we need to also educate people about the HIPAA law, and also the normal general data protection regulatory law that we all need to abide in, in terms of how we share data, who has access to which data, how do you store these data, how these data are being utilized. We need to also always adopt, a data privacy standard for all these assets. Now, also for use of AI, there has been a concern over it, and that is why things like responsive AI, trustworthy, responsible AI, trustworthy AIs are all coming into the conversation around the world, making it that whatever data that are being released out there, you can always trace it to a clear data set, so that when you are training those data, that there's a particular segment or people who have given a clear concept, or maybe given approval, and you can trace how those data are being emanated from. So these are things that we need to all put in place, the framework that also need to be adopted, for us to be able to ensure that we have ethical use in the use of data sets, or AIs. Then also for the telemedicine, we just like we have with our WhatsApp, where we have end-to-end encryptions. Whatever conversations or services that are happening on the telemedicine platform, we need to have end-to-end encryption of all those communications, so that there won't be attacks like man in the middle, diversion of communications, or even denial of service. There are a lot of things that has to be also put in, either from the infrastructure, from the application, or from the use of these technologies. We need to enforce those data governance. We need to implement these regulatory standards to be able to maintain good regulatory framework. Thank you so much.
Yes, thank you very much for sharing this. It has been quite insightful. One point I also wanted to add, especially when gathering data for use of AI training, for instance, people need to also understand the need to de-identify this data, such that even though you are using my data, you don't have to tag it with my name, so that I'll be protected, and then my data can be useful to you. So it's also one of the points that needed to be considered when gathering data, especially for use of AI. So thank you very much. I think this would be the end of the fireside session. So thank you all for the contribution. I believe it has been very, very educative, and we have learned a lot from your presentation and your experience. So we're moving to the last segment of the program, which is the taking questions from the participants. So I'm checking the chat section now, and I've seen that we have a lot of questions coming on. So I believe we just have to take like three questions or four, so that we don't eat into like other people's time, because actually the time allocated for the meeting, for the webinar, has been has been exhausted. So now we just want to take extra time to answer these questions. So the first question we have here is from, okay, let me. Okay, the first question we have here is saying, how can healthcare balance AI innovation? How can healthcare balance AI innovation with data privacy? I think Mr. Titus already mentioned that while answering the last question. So we'll move to the next. Okay, somebody is asking for the email of the speakers in the chat session. So I believe this can be shared across after the meeting, or the speakers, you can just kindly drop your email in the chat section so that every participant can just have access to it. Okay, so the next question says that, what is the future of AI in healthcare delivery? I think this also has been covered in the presentation by Mr. Titus, so I'll just skip that because we don't have much time. Okay, somebody from MyLikita says, we are currently deploying EHR across multiple hospitals. Given the challenges of network outages and connectivity issues, how can we effectively leverage your platform to ensure seamless operations across these hospitals? I think this question is directed at Mr. Laurie. So I don't know if you can just give a brief answer to that.
Controversial again, because I understand governments don't like, all governments in every country don't like many other letting money go out of the country. That's fine. However, when there is the challenge of legacy infrastructure, I call it, and we're just the same in many respects. My suggestion would be that each facility, healthcare facility, especially for hospitals and for medical centers, I would suggest that satellite, guaranteed, seamless, you can go anywhere. If you want to put a fiber optic cable in, you need to dig a bloody great hole. You need to lay out expensive cable, etc., etc. And then you need all the infrastructure in between to connect it. Satellite, straight up, straight down. That's all you want. Done. I'll leave it at that. Thank you.
Okay, thank you very much. I think that's answers the question. So we have another question for Mr. Laurie. I think it's 4 questions in one. So the first one says, what do you consider as the competitive advantage of your product in Nigeria market and Africa? So, okay, let me list out the questions that you can just give the answer. Maybe some of the answer maybe you can combine it together and give your answer. The second question says, which market niche both in public and private sector is your product targeted? Which market niche is your product targeted? What's your pricing model? And is there a freemium version of your solution? Freemium in such that maybe someone wants to test for a period of time, then upgrade to premium version. Freemium.
I'll just start with the bottom one. And I'll just go and get a link for you.
Okay.
This is what I've been responsible for. I have no association with the company that runs it. However, I know the company that provides it, which I've been demonstrating, and there is a whole wealth of stuff, data. I haven't had the opportunity, but potentially you may wish to consider just the opportunity on data in the future. And if you just
okay,
this is publicly available. There is, if you register as an email, you can have it for as long as you want.
okay.
Just register. You can enter as a guest, but you only allow you for so many minutes. But if you register, it's publicly available. Everything I've shown you tonight is publicly available. Now, getting back to your other questions, which I just went down. competitive advantage, cost, interoperability, infrastructure, whatever you want to call it, all in the cloud. Only need a browser, only need the internet, and you can make, well, let's just say, reduce your waiting lists. There are many countries that keep on dreaming of waiting lists, but there's the old adage, we keep on doing what we keep doing. I don't know why. Anyway, pricing model, simple, software as a service, and it depends on usage. That's all. There is obviously a deployment cost, but once that's paid, Bob's your uncle. It is not like paying out hundreds and hundreds of millions of dollars, or say whatever US, to big companies that want your money. Why reinvent the wheel? I do question. But anyway, that's up to the leaders in governments. It's about collaboration, working with each other for mutual benefits. Thank you. I think that answers all of them.
Yeah, thank you very much for that. So another participant asked, is there a chance to share your slides deck with us at the end of the webinar?
I haven't given a slide deck. I can provide a slide deck if you wish me to.
Okay. So we can share this to all the participants at the end of the webinar.
Yep.
The slide decks. Okay. Then somebody asked a question directed at Mr. Titus. He says the question, okay, how can MyLikita collaborate with NHIA to drive the healthcare initiatives?
Okay. We have a what we call the National Health Insurance operational guideline, and we are actually remodeling that operational guideline by introducing people we call the third-party administrators, the TPAs. I believe in such kind of category is where we are extending collaboration to startups, to private sector who have good contribution towards some services that will also help the National Health Insurance Authority. So through this medium, we are extending hand of fellowship and collaboration and partnership to people to come up on board. Either you are providing services that has to do with telemedicine, you are providing services that has to do with predictive analysis. You're also providing services that has to do with what do you call it? A lot of services actually, claims management, you know. So there are a lot of services that we believe through these third-party administrators, NHIS can bring people on board, you know. So we have room for MyLikita to come up on board as well.
Thank you very much. I think we'll check that out after the session. If you have any question, I can reach out to you maybe for further clarification.
All right, thank you.
So, okay. So the next question, okay, you have answered the other question about data privacy. So you said we need a strong data governance and regulation by implementing strict data protection framework like, okay. So this is just what you explained to us during your, while answering the last questions in the fireside chat. Okay, I think this last question is directed at Mr. Laurie. Is there an on-premise version of your solution?
No, there isn't.
Version.
It's all in the cloud because it involves tens and tens organizations. They all share the same information. If you're talking about the health services library, so you eliminate thousands and thousands of provider directories, so it's in the cloud. Alternatively, if you're talking about the health map, exactly the same again. Scale, sustainability. Just one is repeating it multiple times in every single hospital, don't start me, in this day and age of technology. And also maintenance. You can maintain it in one central place instead of thousands and thousands and thousands that you can't maintain. Data accuracy and currency is the most important thing. Thank you.
Okay, thank you very much for the answer. And for the participants that would like to connect with the speakers, we have shared the link to the LinkedIn profile of the speakers in the chat. Please take a look at the chat section and you can get the LinkedIn profile. You can connect with them. For your further question, you can reach out to them via LinkedIn at any time. And I believe all your questions will be answered. So also you can drop your own LinkedIn profile on the chat so that you can maybe have some connections from the meeting. Okay, so I think this has brought us to the end of this webinar. Thank you all for joining, and thank you to our speakers for taking out your time to prepare and even join and make your presentation and let us learn from your wealth of experience. We really appreciate your time and effort, and we hope that we'll be able to reach out to you at any time, whether with questions or this kind of program is being, if this kind of program is being organized again, we can reach out to you for sharing more experience with a wider network of people.
Thank you.
Thank you.
Thank you for the opportunity and everyone who attended. Appreciate your company.
Thank you. So
thank you so much.
Yes, we'd like to take 1 or 2 minutes to take a final thought from both speakers to share your final thought with the participants and any advice that you have for anyone that is joining on this webinar.
Who's first?
Yes, Mr. Laurie, go first, please.
I'm not Mr. Laurie, I'm just Laurie. Okay, I've got a name.
Okay, Laurie.
Oh.
No problem. I'll get used to it.
Yeah, I'm sure you will, Mr. Just from my experience, the tools are available. It just takes the coalition of the willing to implement it. Money, yes, they cost, but they do not cost as much as what the lack of health care does to a community or a national, to the whole community. It is freely available. Collaboration brings benefits not just to the government in healthcare, but it also, as you've seen in the analytics, will save money and increase effectiveness of your existing resources, i.e. you actually save money. And I'll leave it at that. Start small, don't go big bang. And if you're going to do a strategy, don't bother unless it's only for 1 year, for the simple reason, as I mentioned before, I've seen so many 5-year, 10-year strategies, lots of words, people make money out of talking in lots of words. However, what do they achieve? A big fat zero. I've been looking at one website in Africa and they promised the world and they haven't done anything for a year. Oh, rest my case. Here is our strategy. Sorry, doesn't go down with me. Anyway, enough of that. I could rabbit on all day. Thank you very much for the opportunity to talk to everyone. Appreciate that. You're on mute, Mustafa. Thank you.
All right. From my own side, I will like to also come from the area of digital literacy, trying to let everybody know that the world is evolving. The healthcare environment also is evolving, and there are a lot of digital tools that are out there, that are called either global tools or global goods tools, open source solutions that even if you don't have the money, you could leverage on or can go for small open source, applications, call it open EMR OpenMIS, DHIS tools, you can use to help build or also help bridging those gaps that we're already experiencing. You might not have a fat budget for you to be able to get these things done, but we should start taking hold on to little ones that we could just download or access, through our mobile phones, our smartwatch, through all these gadgets. They will really help, So let's work with what is happening around the world. The world today is digital, and it will continue to be so. So let's just come up all on board and probably take it higher. Thank you so much.
Thank you very much. Thank you. We really appreciate you. We really, really appreciate your time. We appreciate your efforts. We appreciate you being with us and everything you have shared with us. So the last part, we would like to take a group picture. If the participants will be, if you permit me to take a group picture, so we need everybody to turn on your camera, then we can take a overall picture of this, the members of this meeting. So please, let's turn on our camera, then let's take a good picture, a group picture. Okay, some members are still trying to turn on their cameras. Okay, I believe we are good. Let me switch the view. Okay. Okay, it seems people are shy to turn on their camera, so we just go with what we have. Wow. We only have like 6 people turning on their cameras. Yeah, okay, good. 1, 2, okay, we have 7 people now. Currently, we have about 28 participants, so I wonder where the remaining 20 people are. Oh, I don't want to believe that it's AI that joined this meeting. It's not a robot, right? Okay, so let's just take it like this. Okay. Thank you very much. I think that is done. So you can turn off your camera if you want. And I think we have come to the end of the session. Thank you everybody for joining, and hope to see you next time we organize another session to enlighten us again on digital health and health information management, AI in healthcare, and other topics that you'll be interested in. Thank you.
Thank you, everyone. Take care.
Thank you, everyone. Goodbye.
Thank you. Bye bye.
Bye.
Okay, bye.